Hey everyone, and welcome to the PTCB Prep Guide. Today we are diving into a topic that's, well, it's a huge one. We're talking about the DEA Controlled Substance Schedules. And trust me, you're going to want to know this stuff inside and out, not just for the exam, but for your actual career.
And I know what you're probably thinking. Oh, great, a bunch of schedules and rules to memorize. It can definitely feel like that at first, but I promise you, there's a logic to it. Once you see the bigger picture, it all just clicks. And really, this goes way beyond just passing a test. This is about being that sharp, confident tech who knows exactly what to do when these important meds come across the counter.
So here's how we're going to break it all down today. First, we'll talk about why these schedules even matter. Then we'll get into the nitty-gritty of the 5 schedules themselves. After that, we'll cover how to handle the prescriptions and what to do with storage and records. And to finish it off, we'll hit the top exam points you absolutely have to know. Sound good? All right, let's jump right into section 1. So why do we even have these schedules? I mean, it's not just some random system designed to make you memorize drug names for fun, right? The reason is way, way bigger than that. It all comes down to one thing: public safety. Yeah, at its core, this whole thing is a giant balancing act. On one hand, you have to protect people from the very real dangers of abuse and addiction. But on the other hand, you have to make sure that patients who genuinely need these medications can get them. For you as a tech, knowing these schedules is basically your rulebook for how to do your job correctly, legally, and safely. So let's define our terms. What is a controlled substance? Simply put, it's any drug that the DEA says has the potential to be abused or cause addiction. And that word right there, potential, that's the magic word. It's the key to understanding this entire system. Okay, so speaking of that system, that brings us right to the main event, the 5 DEA schedules. Let's dig in and break down what each one actually means. Now look at this. This is probably the most important concept to get right off the bat. The whole thing is basically a ranking system, but it's kind of backwards. The higher the schedule number goes, like from I to V, the lower the potential for abuse. So Schedule 1, that's the highest risk. Schedule 5, that's the lowest. Just burn that into your brain. Higher number, lower risk. If you get that, you're already halfway there. All right, let's kick things off with Schedule 1. Think of these as the total outliers. Why? Because they have the absolute highest potential for abuse, and this is the key part, they have no accepted medical use here in the US. That means a doctor can't prescribe them. So yeah, you're not going to be filling a script for heroin or LSD anytime soon. Okay, moving on to the one you will see constantly in the pharmacy, Schedule 2. These are the big ones, the high-stakes drugs, and let me tell you, the rules around them are super, super strict, and for very good reason. Now, unlike Schedule 1, these drugs do have accepted medical uses, but, and it's a big but, they have a really high potential for causing serious physical or psychological dependence. Now look at these examples: oxycodone, fentanyl, Adderall, Vicodin. These are going to be all over your PTCB exam, so you definitely need to know these names. Okay, everyone, listen up. If you remember one thing today, let it be this. For Schedule 2 drugs, how many refills are allowed? The answer is a big fat 0. None. Nada. Zilch. Every single time a patient needs more, they have to get a brand new prescription from their doctor. No exceptions. Okay, so that covers the really high-risk stuff. Now let's talk about Schedules 3, 4, and 5. It's easiest to just group these together. Think of them as a sliding scale of risk, getting lower and lower as you go up in number. They all have legitimate medical uses, and the potential for abuse goes from moderate down to low. You'll see things like Tylenol with codeine in Schedule 3, Xanax in Schedule 4, and some cough syrups like Robitussin AC in Schedule V. And this slide lays out the other big refill rule perfectly. So we've got Schedule 2 with 0 refills, right? Well, for Schedules 3, 4, and 5, it's totally different. For these, a patient can get up to 5 refills, but here's the catch. It has to be within 6 months of when this script was written. After 6 months, that prescription is expired and they need a new one. Okay, let's just pause for a second. That was a lot of info. We just went through all 5 schedules and the 2 big refill rules, 0 for C2s and 5 and 6 for the rest. How are you feeling? If it's all making sense, then let's get into the practical side of things, what you actually do with this knowledge in the pharmacy. Perfect. So now that you know the different categories, let's put you in the pharmacy. A patient walks up and hands you a prescription for a controlled substance. What happens next? What's your role in all this? Think of this as your mental checklist. First things first, it has to be from a prescriber who is registered with the DEA. You've got to find that DEA number on the prescription and make sure it's valid. And this isn't just busy work, you know? You and the pharmacist share the responsibility to make sure that script is legit. And of course, before you fill anything, you're going to double check those refill rules we just talked about. Okay, so you've checked the scripts, everything looks good. Now what? What happens behind the scenes, behind the counter? The rules for storing these meds and keeping records are just as important, and you can bet you'll see questions about this on the exam. When it comes to ordering Scheduled II drugs, there's a special process. You can't just order them like any other medication. It has to be done on a specific form, the DEA Form 222. Then, when that order shows up at the pharmacy, you have to check it in super carefully, and then immediately lock it up in a secure cabinet or a safe. And of course, all that paperwork has to be filed away properly.
And that leads us to another huge rule for the exam, the 2-year rule. It's simple. Basically, any record related to controlled substances, ordering, inventory, what you've dispensed, all of it has to be kept for at least 2 years. And these records have to be ready to go because the DEA can pop in for an inspection whenever they want.
Whoa, okay, we've covered a ton of info, so let's wrap things up by boiling it all down. What are the absolute must-know, top-tier facts and tips that are going to help you crush these questions on your exam? Okay, here's a great little memory trick for the refill rules. For Schedule II, just think it takes 2 hands to handle these serious drugs and you get no refills. Simple. For Schedules 3 through 5, just remember the number 5. You get up to 5 refills. It's a silly little trick, but trust me, it works. So here it is, your final exam hot list. If you walk away with these 5 things down, you're going to be in fantastic shape. First, know the schedule hierarchy, how the risk goes down as the number goes up. Second, master those refill rules, 0 for I, 5 and 6 for the others. Third, know those high-yield drug examples we mentioned. Fourth, remember that C2s need a locked safe. And finally, always verify that DEA number. Got it?
So as we wrap this up, I want to leave you with a final thought. All these rules and facts, they're not just answers to exam questions. They're literally the tools you'll use every single day to do your job right. So the real question isn't, can you pass the test? It's, how are you going to use this knowledge to protect your patients? Because that's what it's all about.
And that's a wrap on our guide to DEA schedules. I really hope this made things clearer and helped it all click into place for you. Hey, if this was helpful, do me a favor and hit that like button, subscribe so you don't miss our next prep guide, and maybe share it with a friend who's also studying. You all are doing great, keep up the hard work, and I'll catch you in the next one.